Folks, welcome to another episode of the I Am GPH podcast. Today we have Joshua Prasad. Josh is a strategist who is working on tearing down the structures that prevent an equitable society while also considering barriers to behavior change at an individual level. This has taken line across government politics, big consulting, nonprofit, payers, health tech, and direct care delivery, where he has led and advised leaders with his unique guidance. Many of his ideas center around the end user and applying design to underlying causes. He's working to change the current system's paradigms from being healthy enough to survive to be vital enough to thrive. Joshua is currently doing a DrPH, doctoral in public health at NYU GPH, and he's also working on a new venture called FWD Slash. We can't wait to hear all about it. With that said, Josh, welcome to the I Am GPH podcast. We're glad to have you
Thanks
here.
for having me, Amin. And thanks for reading the canned spiel about me too.
So let's hop right in. And why don't you start with giving a brief intro on what you're up to, what you're doing today, because we have an extensive list of things we can talk about with you, and I'm sure you can inspire and encourage students all around the world. But how would you introduce yourself today if you could pitch yourself in essence?
I'm formally a student here at NYU, and so I think that is the technical way to describe myself. I am a doctor of public health candidate here at the School of Public Health, and certainly encompasses part of it. But I'm working regularly in the field. I picked this degree because it is a practical degree. It's one where I get to learn a bunch of new stuff, but also do things in the same breath. So that's really exciting. But overall, I guess I describe myself as a learner through and through, not just in the formal education process. Everything I've done in my career has been an attempt to continue to learn new things and try and solve some of these nitty-gritty problems that are out there through an air of humility, hopefully, and learning other people's needs and trying to solve them. So that's what I describe myself anyway.
Okay. So why don't you share with us about your path into the world of medicine? How did you get introduced to the world of medicine, and how has it transitioned over the years as you have immersed yourself in this area?
Yeah, sure. And well, I guess I'll start by saying that I'm not in medicine. I think at some point in my career, I probably dabbled with the idea of being in medicine, but I actually think I'm truly in health. And health is this beautiful, complex ecosystem that sometimes includes natural and life science stuff like medicine, but it also includes this really complicated and usually broken social and environmental systems that make up our experiences in health and in well-being. And I think that's where I work, and I'm more interested in working in at this point. So not medicine, I'm in health. My path to it is non-traditional, insofar that there is any sort of traditional path to anything. In undergrad, I was an undecided college student who majored in psych and English. I was really interested in bringing my natural skills, which is I think in writing and storytelling and that kind of stuff, and creativity, and using it towards something at the greater societal level and population level. So I started exploring behavior change through psych, sort of took it to its broadest point at a more sociological level. I got my MPH at Drexel, and I guess stupidly, because it's not really my forte, dabbled in biostats and epidemiology, but really found my way back into policy and management, which are I think hinge more on a good, strong ability to write and storytell, like I said before. And spent my the earlier part of my career and my internships and my jobs in the government space, city, state, federal government, and really took a liking to it. And so that's how I got there, or got here. There's a lot of other pivots and tangents that I think every career take, and that's why every career can take. And that's why I'd say that I'm not in any sort of traditional path, because there isn't one.
So I love hearing the non-traditional path, and a lot of the people that have come on our podcast have mentioned this element or insinuated a non-traditional path, to say the least. And for you, you've been in government, you've been in multiple places, and a lot of people jump jobs every year today, but you have had some consistency in one environment when we look at you and we see the journey you have had. But still, there seems to be a diverse element of growth in that. So what was that journey like for you? Could you tell us more about it? Because a lot of people these days, from time to time, are thinking, should I get this job? Should I get that job? People are jumping jobs from year to year. And what was that journey like for you? The consistency versus the diversification as well.
Yeah, so I think the longest job I've held was at HHS. And sorry, it's No Shave November, and there's 2 days left. We should have scheduled this next week. I'm just gonna keep scratching my beard here.
You're looking good, man.
So I spent the longest part of my career, I suppose, in one entity at HHS, mostly during the Obama administration, and it was a really important time. It's a double-edged sword the way I look back on it now. I was fortunate to have a job and a boss who were really supportive, and I kind of walked into, I think I worked hard for it too, but I walked into my dream job as my first real grown-up, postmasters, post-grad school degree job, and I had that supportive boss who I still consider a mentor now, and that helped me stay there for those 5 years, and to the point that I was introduced by more senior people at HHS as, hey, new intern class, get to know Josh because he's going to be here forever. And little did I know, little did they know that that would actually change at some point. I thought I was in it for the long haul. The double-edged sword, because the bar was set too high. I've worked in other places now, public and private sector, different types of environments, kind of always challenging myself to find new environments that work for me and new challenges that excite me. And without, calling out anyone specifically, I'll say that that first boss, the second boss that I had, both of them were really good. They're unique. Bosses who care about your growth and your trajectory are really hard to find. Having mentors who care about you outside of that early career part of your life is really hard to find. And I think a lot of supervisors say, well, I got a junior person, so I got to take care of them. But when you're a junior person, you're like, I need someone to hold my hand through it. And I think that that is the wrong way to think about it. As someone who's taken on supervisory roles too, we all need mentorship at different points in our career, and that has helped me realize that I need to go to other places and try new things. That first boss, he told me back then, I remember, it's a long story as to why this conversation came up, but he told me that I should take every interview that I get. And if it's a job I'm interested in, I have to try it. I have to make it a decision for myself. He told me, and this was, I think, the helpful insight, is that it's my job to keep challenging myself and looking for things that are going to keep me happy. And it was his job as my supervisor to try to get me to stay. And if he can't do that, if he can't pay me more, if he can't challenge me with new things to do, then it's the right move for both of us. We need to keep moving on. And I think I really appreciated that guidance because it speaks to this overall ethos that I think my generation and the generations after me are moving into, where we change jobs pretty regularly. It's, I think, at this point necessary for all of us. The days of working a job for 40 years until you cash that pension, I can't imagine doing that anymore. There's just too much to do. And no one organization, no one team, no one experience is going to help you achieve that.
I love hearing that. And speaking of that experience, the diverse set of experience, I'm curious to hear about, you worked in private and you worked in government as well. So what was that experience like? A lot of people graduating consider, should I go into government? Should I go into a private role? So you had some experience at Deloitte compared to your time in government. What were the differences that you noticed working in these two environments, or what were those experiences like for you?
Yeah, this is could be a contentious one, I suppose. But it really just comes down to what you need as an employee, as a boss, as whatever you are in this public health space or in this world. they both offer you different things. So Deloitte, comparatively, I'll say that I had the best teams and best bosses that I've worked with in that early policy experience. Deloitte takes care of you. It's a big company, and I was used to working on small, scrappy government teams that have, we're all doing 10 jobs at once. Deloitte has the resources to really take care of their employees. And so for me, it was really important to move there, I think, at the point in my career that I did, because they're a big, well-known consulting firm. They have their hands in everything. I was still figuring out which directions to go and how I can better my skills and learn some more robust formal business training. And I think I got that project management and high caliber strategy work. It's because of Deloitte. And so from that perspective, because of their sort of formal structures on things, I got a lot of that experience. I'll say that the trade-off for me anyway was where you can get impact. Deloitte, for me, big consulting, and this is not a knock on them really, it's just how they do business and how they do their work, is they're a few steps far removed from where impact is. And my locus, I think it has to happen a little closer to real people and real communities. When you're advising or consulting to an organization who's delivering change, you're not the organization doing the change. And so it's just a few too many steps away from me. So when I got the opportunity to go back to government, I did, and it was I think it was actually kind of a cultural change to go back. There at Deloitte, all of your travels covered whenever you're going for a client thing, and you got your fancy new phone and laptop and top of the line kind of stuff. And government, it's the taxpayers' dollars, so you're scraping by with whatever you have, but you're doing really, really impactful work. I don't know. I think government relies a lot on proximity to power, if you will, and impact. And we have small budgets and small teams, but really passionate people. I think the government stereotype that it's like lazy workers or not bureaucracy that exists, but most people come into it because they love what they're doing and want to keep growing it. And so for the students who are interested on the policy side, there's many ways to do it, and neither one's better. You have to just evaluate what you need in your life. We all, especially with student loans and that kind of stuff, like we want to make a big buck and do impact work. That's why we're here in public health. I think don't pretend like that's not the case. Like you could have gone to finance with most of us are smart enough. We can go into another field if we really want to. You came here because you want to do something impactful. Like just measure all that out, put your feelers out there and see where you wind up. But neither is right or wrong. Both government and big consulting can offer you some wonderful opportunities and skills.
Oof. All right. So there's something deep there for the students, right? Where most of the students here and people in this space are here to make an impact. And with that comes a path that some people need to define. And you have been through your own path. And what would you advise to the students? Like, how would they find their path? What do you think are some words of wisdom, if you will, or generic elements that apply to all cases? How can students learn from an experience to design their own path when going forward in the world of public health?
Design their own path. I think that's the right way to think about it. I think, I get this question a lot. I think many people do at various points in their career. There's no answer to how do you like what people I think want the playbook. I know when I was an MPH, before I knew anything about the field, I was like, man, someone just has to hand me the book of secret answers, and like that's gonna get me to where I need to go. I want to be a policy rock star one day. Like I just need someone to hand me the keys to that pathway, and that doesn't exist. There's no way to do that. I think finding your path is constantly evaluating your own needs and your own desires and your opportunities that are before you, and seeing how are you going to get to where you want to go, why you originally got into the space in the first place, et cetera. And so, like I said before, I don't think any one job is going to fulfill that. And so for me, bouncing around, learning a bunch of different things, trying to attack a problem from different angles has really helped me get to that point and get to that path of understanding. So keep pushing yourself to be intellectually challenged, impact challenged, life challenged, salary challenged. I think no one wants to take a pay cut. No one wants to jump into the unknown, but it's kind of important to deliver impact that sometimes you're going to go into a space that doesn't have a lot of money in it, but you got to figure out how to make that happen if you want to solve it. The reason some problems still exist in the world, some public health problems that we all care about, the reason we're in this space, is to solve those problems. And maybe it's because there's no business there yet, but that's what I think entrepreneurship and startups and that kind of world can help create. Not that everything has to be a business, but you know what I mean? So to get back to the core of your question, there is a core thing inside of all of us that we need to evaluate. Figure out what that is, and that will help you drive your path and have fun along the way. I think that's the actual way to do it.
Love to hear that. So you're a great example of someone that has designed their own path, and it has designed this entrepreneurial venture that has been generated and created forward. So lot of folks are wondering, what is an entrepreneurial path like in this world? Can you tell us about how your entrepreneurial spirit reignited, or did it come to play later on? Did you always have it? What was that journey like for you where you realized, hey, I'm going to take the more entrepreneurial path when I go into this world of public health?
Yeah, I don't know when it clicked, because I don't think it ever did. I think it's been like I was saying before, this evaluation of am I happy? Am I not? Am I doing enough? Am I doing too much? That ebb and flow has been really motivating for me. And so sometimes when I feel like I'm not achieving what I want to achieve, and admittedly, I think our generation of millennials and younger, we have this idea in our head that we have so many problems in the world, we got to solve them, and like that definitely plays into it too. But at a personal level, there's a level of fulfillment that I think I've explored and tried to deliver upon. There was no specific thing that clicked that was like, you're going to be an entrepreneur today. That's how it works. No, it was more that there was opportunities to. I found opportunities that really excited me because it wasn't being done elsewhere, and the idea of being an early adopter to something was really interesting to me. The silly question that I think many of us will experience is, how come no one's done this before? Like, what no one's doing this? Like that's like, it sounds silly, but whenever that question's asked, I'm like, it's ridiculous that no one's doing this. We need to do it. We need to figure out a way to do that. And I think that's what excites me, and that is what has gotten me to this point. So it started in my first policy job, where there was things that weren't being solved. How can I do it better? How can I do it more efficiently? I had a mandate on the things I was supposed to do, but I was still trying to figure out ways to solve it more efficiently or better, or with subtle improvements. Government job, there's not a lot of budget for that kind of stuff. All the way into forming my own company or companies and trying different things, just to be experimental, take a little bit of that personal risk. But hopefully with that risk comes greater reward. Professionally, I'd say that's where it comes from. Personally, I think just problem solving. I have an innate desire to solve problems, and coming from a low resource family with who's risk averse, when I was younger anyway, and just, if I wanted something, I had to figure out how to solve it and do it myself. And my parents weren't always supportive of it, but once it worked, they were. So I think I took that into the professional realms as well too.
Wow, thank you for sharing that. I'm sure that strikes a chord with a lot of people and inspires them to move forward. I'm curious to hear about how now. Tell us more about /. How did it come to life for you? What are you working on? What is it all about? What does it stand for? What makes you show up every day and build this thing.
Yeah, it's an exciting new opportunity. I think, although it's not that new, we've been working. My co-founder and I, Samir, we've been working on this for a couple of years now, and have tabled it, gone do other things, come back to it. But we're finally, I think, we've hit a point that it feels right to pursue full time and do not as a 9 to 5 job per se. I mean, we are doing that, but really, it just seems like the right time in the problem that we're trying to solve to go after it. And so we're solving homelessness, and we're using a housing model as a way to address the costliest and neediest patients and their social determinants of health through Medicaid value-based arrangements. And so that might sound like a lot of jargon to you, but basically we're helping Medicaid plans put people who have used the healthcare system more and they're on Medicaid into what we'll consider life-changing and stabilizing housing, and help them get to where they want to go, and at the same time, lower their costs and improve their health. It really builds on the philosophy of housing first, if you're familiar with that, the idea that, or looking at just basic psychology, Maslow's hierarchy of if we solve these sort of basic problems, we can then solve a bunch of greater order healthcare problems as well too. And so what we're actually doing in that process is we're enabling community-based organizations to participate in healthcare. These amazing nonprofits who are doing some of the hardest work in our communities, they're now able to tap into the healthcare food chain. They're the ones who are going to help us, who are already helping us, I should say, get people into housing and see about around a 40% cost savings for these members or patients. And it's pretty fun. I'll say it's a combination of all of these different experiences. And so it's exciting to say that we have some early success, and we've signed a contract, closing a few more, but also know that there's a ton more to do. And so we're really building something here from the ground up and kind of tapping into a bunch of different parts of not just the healthcare and medicine chain, but really social enterprise overall, and just trying to solve one of the hardest problems out there. And so we know it's going to be tough, but if we can close this equity gap, we think we're going to be on a path to justice for a lot of people here, and hopefully build communities along the way.
That's amazing to hear, and we wish you nothing but the best on that. I mean, you're doing something amazing. I'm curious to know what does a day-to-day look like for you working in this space. It seems like it's very dynamic. You mentioned so many different things that are happening on a daily basis, similar to similar to what you described in the world of government, where there's multiple things to do every day. And what is it? Is it similar for you?
It is strange. Like, people wouldn't normally, I think, relate the two together. Startup, Silicon Valley-esque organization. We're not actually based in Silicon Valley, but you know what I mean, like that type of organization versus the entrenched bureaucracy of government. I think there's a lot of overlap between the two, and so day to day, check an email. That's what every job is. But actually, it's right now we're heavy in the fundraising process, so we're doing a bunch of pitches and really trying to build a strong base here, so that we can execute these contracts that we're signing and grow a team that is bleeding edge, if you will, that really brings together these disparate needs. We already have a few people on board, and so that's really exciting. And so our path there, or our day to day, really is just working in our teams, getting in touch with these communities that need our help, and solving their problems, and finding ways to do it. And the unique challenge there is making the community-based problem, in this case, homelessness or housing, and other social determinants fall into this too, like food and transportation and other needs that people have, making them speak the language of health insurance and healthcare and big contracting and that kind of stuff. And we're blending that together. And so it's a combination of everything, for sure. And it draws, I at one point ran a small health center, draws on that experience too, all the work I did with patients individually and working with small teams there who just knew their community and knew the people that they're serving every day. Like that's definitely part of this experience as well too, and certainly the stuff I did with the big consulting and the government. And I ran I did found a company a few years ago as well, and learned a ton in that. Learned a ton of what not to do. The first time when undoubtedly we didn't pan out. We were focused on community health workers at a time when no one knew what community health workers were. But we were growing something, and I learned a ton about how to build a company from the ground up then, and team selection and problem solving really go hand in hand. And so I think this time I have the opportunity to do it de novo from the start. But do it right and really pick the team methodically so that we know that we can solve these really important problems in the best way possible. And so that's my day-to-day right now. I'm also going to school. I'm also doing some side hustles to make a few bucks in this early founder stage, but hopefully moving into the full-time opportunity or full-time role soon enough.
You're someone who strikes me as an individual far ahead of their time, and with the community health worker program, something similar. So I'm sure there's a lot of listeners that also have a vision, they have a dream, and if you could leave them with a final word on you have something, you believe it's going to work, you believe it's necessary, but there's numerous things happening. Imposter syndrome, is this even worth it? Are people going to invest in this? I'm sure you face that on a regular basis. So what would you share with individuals that do have that vision, they do have that dream within the world of public health? Should they go for it? What are some things you'd share with them?
Yeah, well, the TLDR on it is go for it, absolutely. But I'll say I get this question a lot. My co-founder gets it a lot too. Public health and he's a doctor. People come to us and like we've been talking about here, and they ask, like, how do we do what you do? And like I said, when I was a MPH student, I was looking for someone to hand me the playbook to success. There's no such thing. If there's a problem that really bugs you, you have to go and solve it. You have to go figure out a way to solve it. Some piece of it, the whole thing, whatever that means to you, go after it and do it. And don't let anything stand in your way to do that. And sort of like my first boss's advice to me, go take every interview. Same sort of thing applies here. Go take every opportunity that comes your way, and make that a decision for yourself. Don't let it decide for you. You have to decide it. And so I think the same sort of thing. If there's a problem that really bugs you, if there's something that you got into public health to do, or something you just learned yesterday that needs to be solved and it really incites something in you, go do it. You have to. And I think following that passion and then whatever you're good at on the inside, and side note, I think the most important skill in public health is networking and relationship building. Getting to meet people, meet your group of people who help support you, and learning how to leverage them and get leveraged by them is really the key to everything. That's the actual playbook. Is not a written book, but it's the people in this space, because we all care about it a lot, and we all have different ways of pursuing it, and no one of us is going to do it ourselves. So if we can work together and build a collective system here that we agree needs to be fixed, I think there's a ton of opportunity that comes with that. So I think I answered your question, but yeah, no, like I said, TLDR, go do it.
Go do it, folks. Go do it. Remember, if there's a vision you have, there is a community out there to help you with it in the public health world. Trust yourself, network, and listen to this interview again and again if you are forgetting some things. With that said, Josh, thank you so much for your time. We wish you nothing but the best on your new venture going forward. And thank you for doing this podcast.
Anyone who wants to learn more about our company, we got www./.org. That's FWD Slash.org. Tons of info on there, and constantly updating it. So check us out.
Check it out, /.org, everybody. Thanks, Josh. Thank you, everyone, for tuning in to another episode. I will see you next time.